The Kaiser Family Foundation presents health08.org, election news, analysis, and events.
Andy Stern, President of the Service Employees International Union, thanks for joining us on health08.org.
Thank you.
Single biggest problem facing workers who are in the healthcare system today? Cost, access, quality?
A lack of a system. I mean, we really have a healthcare sector, not a healthcare system. Not everyone's covered. Doctors, hospitals can't talk to each other. We don't have any real way to put value on healthcare. So we need a system that has everyone in and has some protocols and way to do this work a lot better than it's being done today.
Last year, in 2007, February of 2007, you helped create, and the union is part of the coalition called Better Healthcare Together. Some strange bedfellows in there. Walmart is a member. Is that part of your answer to some of these problems you just described?
Well, I think the answer is that we need to appreciate we've gone from having a moral crisis about healthcare to an economic crisis, and no one can tell that story like the business community. I mean, America can't be the only nation on earth that puts the price of healthcare on the cost of its products and then competes with countries around the world that don't. So we now have an economic problem, and we think it's time the business community stand for quality universal healthcare and not just sit on the sidelines like they did in 1993.
What are the broad principles that the members of the coalition have and can agree on?
Everyone's covered, everyone's paid. You know, we try to deal with prevention, technology, chronic diseases, the things that are really driving cost in the system and the things that are necessary to make it a system.
As I say, as we speak now, it was created about 16 months ago. Has this collection of groups gone beyond those broad guiding principles? Have you gotten down to the details?
I think, as we all know, that when you're at nice 30,000-foot principles, There's a lot of unity around this town, you know, and as you begin to dig down, you know, we have not gotten there. That was never our intention, you know, to start with, to just, you know, dig down to the perfect health care plan. In the end, we're not legislators. I always like to say, if the Congress would like to lock a bunch of us in a room, many of the people you've already interviewed, I think we could solve this health care problem. But in the end, you know, we are advocates, not necessarily legislators.
But what's the what role does this coalition have if it can't get beyond these kind of broad ideas, which probably, if you asked most people in America, they would say, sure, access for everyone, quality, of course.
Well, I'm not a veteran of the 1993 wars, but one of the biggest problems that people said was, you know, you had consumers and a new president, you know, really pushing for change. And you had the business community, either in the case of the insurance industry, the assassins of change, or other business community leaders just sitting on the sidelines. I think Congress feels much more comfortable about making hard choices when they feel like people want them to do it. And it doesn't mean everybody's going to agree on every choice they want them to do, but I don't think we can have another situation where the business community just says it really doesn't matter to us, you know, and the assassins for change come out of the woodwork, you know, in the business community and try to kill it.
One thing you have said in many times in many forums, op-ed pieces, television shows, etc., is that the employer-based healthcare system we have today is a relic, is something that worked with the old economic model, not today. I think what you haven't said is, so what do we replace it with?
Well, I think we could look at what Ron Wyden's done, you know, as one avenue of replacement, you know, using the Federal Employee Benefit Health Plan. We can look at other countries around the world, some of whom have more government intervention, some who have more private market systems, in Switzerland and places like that. I think there's a lot of models here. I just think when you have a kid like my son, 21, is going to have 9 to 12 jobs by the time he's 35. When you have 25% of the American workforce that's contingent, and only 1 out of 3 employers today will be economically relevant in 25 years, how in the world, in a self-managed work life, do you have employer-sponsored benefits? It's just not going to work in a 21st century economy.
Has that statement, has your belief rattled members of your union who depend on their employers for health care insurance?
Well, I think, you know, union members are very fortunate because they tend to be in more stable employers, particularly in our union. You have health care, you have the public sector, you have a lot of service sector jobs, cleaning and security. They're not going anywhere. So I think they're rattled on one hand. On the other hand, they go to the bargaining table every day and appreciate they're barely holding on to the benefits they have. They see their friends and families in their community who don't have any health care at all, and they realize they're one job change, away from complete disaster as it relates to their health care benefits. So, yeah, they're a little bit nervous because they like what they have, but they appreciate they're barely holding on.
The single payer plan is something that you have specifically said you don't like. You don't see that as a model. Why not?
No, we've endorsed John Conyers' bill for single-payer health care. We just think it's a...
But if it's a model based on Canada, for example, I've seen you in print saying that's not the way for the U.S. to go.
I mean, I think we're going to have not a Canadian plan or a Scandinavian plan. We're going to have uniquely an American plan. Medicare for all, I guess, is one way you could have a uniquely American plan. I don't see it in the cards. I don't think the next step in our healthcare system is probably getting rid of the employer-based healthcare system or going to a more government, involved healthcare system. I just don't think that's what Americans see as the next step. They want choice.
Culturally, we couldn't
Yeah, people want choice. They are not yet convinced that the government is the best group of people to run the healthcare system. I don't think they would mind, if it was more financed, with more public money. But I think in the end, they want to be in a position to make some choices, and they're worried right now. And I don't think we should just keep pushing the same rock uphill, because we saw in California when we're trying to get the perfect, it becomes the enemy of the good. And now in California, there's still 5 million people who don't have health care. That was a victory for no one.
Andy, I have heard you say that in the United States we have lost the value of conversation and compromise in the context of trying to push the rock somewhere. Mm-hmm. Were unions a part of that problem, and is that different now, again, in the context of healthcare change?
I mean, I think unions have to be very thoughtful because they're very fortunate compared to other people who do the same jobs. Union workers are twice as likely to have health care. They're much more likely to have a pension plan. And so, we live in a world of a lot of success. And yet we need to understand that this is America. We're all citizens. We have to think about our kids and our grandkids. And yeah, we need to make a compromise because of what we've been doing for the last, 75 years since the New Deal, and we still don't have health care for every man, woman, and child. People still die in this country simply because they're poor. We need to find a better way to have a conversation, make a compromise, and take the first steps forward.